Breathe.
I need to read the interpreter's lips and see her face.
No, we cannot take off the masks. You have the flu. It's contagious.
For 48 million Americans, communication with doctors can be difficult when face masks are involved. The masks prevent deaf and hard of hearing patients from reading lips and seeing nonverbal cues, such as facial expressions. By wearing a traditional face mask, we're immediately placing a barrier between ourselves and our patients, which eliminates our ability to express some of these nonverbal cues. Of course, that prevents us from building rapport with our patients, and that can have serious consequences in terms of clinical outcomes and providing the highest quality care that we can.
When using surgical masks, it is impossible to understand what's going on. Completely lost.
We rely on reading lips and facial expressions.
Can't see a smile or a frown. Children especially need to know what's happening, if they should feel scared or happy.
A big struggle because I'm trying to understand the doctor, what they're trying to tell me, and what my needs are. I typically ask medical staff to pull down their masks, but due to health requirements, doctors can't.
That experience is extremely common among deaf and hard of hearing patients everywhere.
We enunciate words differently. We have our own dialects and accents. These variations are typically inconsequential for hearing individuals, but as soon as we remove the ability to read lips, we find ourselves asking our colleagues and friends if they could repeat what they had just said.
A lot of times it's difficult to hear the surgeon.
It's hard for me to understand them through the mask. I have to sit there and strain to hear, like a delayed processing time to understand what's going on, what they're saying, and if they need anything.
In the operating room and on the hospital wards, there's really very little margin for error, especially when these things are avoidable.
As any patient coming into an emergency department situation where they have a crowd of people around them, it's very anxious and just intimidating and scary. Just taking that simple barrier away.
Even in little children, or even sometimes 6 months old, they know, and we'll see them reaching for the parent's mask to pull it down.
Instantly places a communication barrier between both of us.
When a mother or the father meet their baby for the first time, but unfortunately a lot of times there's a mask on their face and they can't really express themselves.
A ClearMask offers such a simple solution. We've just never thought to break the status quo and do anything about it. The ability for everyone to see each other's faces, emotions, and facial expressions bridges the gap between communication and understanding, fostering the foundation of human connection. A ClearMask achieves just that, providing more than only protection.
Now, clarity, comfort, and connection.